Welcome to the final video, part 8 of the Nutrition and Weight Loss class. This section covers rapid weight loss before surgery and goal setting. Many of you might have a goal weight that needs to be met prior to surgery. This is what was recommended to you by the surgeon when you came in for your initial visit and will be on your individualized checklist. It's important to note that this pre-surgical weight loss goal must be met prior to starting your 2-week pre-operative diet before surgery. You will learn more about your pre-op diet when you come in for your surgery prep class. For those struggling to meet their pre-surgical weight loss goal, we actually start you on the first phase of the pre-op diet. The first phase of the pre-op diet consists of 3 protein shakes and 1 healthy meal per day. When looking at protein shakes, they do need to meet certain guidelines. They need to be less than 200 calories per serving. They need to contain 15 to 30 grams of protein per serving, and less than 15 grams of sugar per serving. Your healthy meal is 3 to 4 ounces of a lean protein plus 2 cups of a non-starchy vegetable. No fried or breaded items or sauces or gravies on your vegetables or meats. If you don't want to weigh out, measure, and prepare, you can use a frozen, portion-controlled entree under 350 calories. We do recommend avoiding those starchy-based ones like the rice or pasta-based dishes. You need to be getting in at least 64 ounces of water per day, and I encourage you get these in outside of your shakes. If you are finding yourself hungry between meals, add in a vegetable or fruit snack to help avoid going off plan. Do note, if you have diabetes, you need to consult with your physician before starting this diet, as some of your medications may need to be adjusted. Also, make sure you're checking your blood glucose more frequently. You are at high risk for hypoglycemia, or low blood sugars. To conclude this 8-part video series, I would like for you to set some goals. When we're setting goals, we want to make them SMART goals. S stands for specific. What exactly do I want to achieve? M stands for measurable. How can I measure this? A, achievable. Is your goal attainable? R, realistic. Is your goal realistic in the time frame set? And T, timely. What is that time frame? So an example of a SMART goal is I'm going to track my daily food intake on MyFitnessPal for the next week. This goal is specific, you can measure it, it's achievable and realistic, and you have a set time frame that you are working on it. A SMART goal would not be, I'm going to lose 10 pounds in 2 weeks. That might be your objective that you would like to aim for. But what I would like for you to do is set some behaviors that you can practice that will help you in achieving that weight loss. So on that handout, the post-test, there is actually 3 areas for you to set goals. I would like for you to set 3 SMART goals that will help you to lose weight, or if you don't have a weight loss goal that still needs to be met prior to surgery, I want you to set some goals that are going to help prepare you for surgery. The last thing we want to do is wait to make changes until after surgery. The more changes you can make before, the easier it's going to be after. So on that sheet, I want you to set 3 SMART goals. Here are some examples of SMART goals. Track your daily food intake on MyFitnessPal for the next month. Increase vegetables and fruits to 5 servings per day. Aim for a minimum of 64 ounces of no-calorie fluids daily. Incorporate exercise 30 minutes 3 times per week. Reduce eating out to no more than 1 time per week. Start the Rapid Weight Loss Diet Monday and follow for 2 weeks. And that concludes the 8-part video series. Thank you for watching. There is some important information that you need to note. Please bring in your completed post-test and goals to your next appointment at Erlanger Metabolic and Bariatric Surgery Center, or scan them in and email them to metabolicsurgery@erlanger.org to receive credit for completion of the nutrition and weight loss class. These must be turned in prior to you being scheduled for your bariatric surgery prep class. If you would like a copy of these slides to reference, please visit our website at www.erlanger.org/bariatrics and click on Bariatric Education.